So for my third and final evaluation for clinicals this semester, I evaluated two different athletes. The first athlete was a wrestler who had gotten a sprain of his first metacarpal at the base of his first metacarpal. The second athlete was a basketball player, and she had fallen on the court on her olecranon bursa and ruptured her olecranon bursa. So I decided to do both of those injuries together because their evaluations were shorter. So to make the time limit for the video, I decided to evaluate both of those. So the first athlete I evaluated, the wrestler who had the sprain of the base of his first metacarpal. First of all, I just palpated along his thumb joints on both thumbs just to see where his pain was. It was right over the base of his metacarpal joint. Then I went through the range of motion testing, so I had him first actively flex and extend his thumb and do adduction and abduction of his thumb, and his pain wasn't really unbearable with that. This injury had happened a few days prior to me evaluating him, so his pain level was a little less than what it was when it first happened. I then had him do the thumb opposition testing actively on both hands, and his pain level wasn't really that much of a big deal on that either. I then went to the resistive range of motion testing, so I had resisted flexion and extension of the thumb, and then had him do adduction and abduction resisted. His pain level was a little higher with those, but again, not as bad. And that kind of concluded my evaluation because there wasn't really any special tests I could have done. I did like the flicking of the end of his thumb, the distal and the proximal end of his thumb to test for fracture, and then Jordan had said that when she first evaluated him, she had done the tuning fork, and he didn't really have any major signs for that, so that was good. After completing the evaluation, she had talked to me about doing the valgus and varus forces to test the ligaments, like the gamekeeper's ligament or like the skier's ligament that usually gets torn with skiing and most of the time. So she told me to just check that for the laxity in that, and once I did that, it showed that he did have laxity with the valgus force. So that was where his sprain was at. So she said that was probably the main part that I missed, was just going over the varus and valgus special tests. I had forgotten about those, so she said just to do those to test for the laxity in the ligaments for the thumb sprain. And so for my second eval, I evaluated the basketball player who had fallen on her olecranon process and ruptured the olecranon bursa in it would have been her left elbow. I evaluated her 2 days after it happened because it happened over the weekend when she was at a tournament. So the swelling had gone down a little bit, but when I compared her swelling bilaterally to her other elbow, it was still a lot more swollen than it should be. I just palpated along her olecranon bursa, just asking where her pain was. I asked her when her pain was the worst, and she said when she was shooting, when her elbow was fully extended, that's when she had the most pain. And so then I tested her flexion bilaterally, and it was pretty good with both, but when I had her do full extension on the elbow that had the olecranon bursa rupture, it was a lot less than the elbow that was uninjured, which is probably pretty common with an olecranon bursa rupture, that her extension would be limited, and that would explain why she was having pain during shooting, because her elbow was going into full flexion with that. In the meantime, she had been icing it after practice to help with the swelling, and then using an ACE compression wrap just during the day to help relieve that swelling. So after that completed that evaluation. Jordan said that she didn't have any really comments for me because there wasn't really a lot of things I could have done to evaluate the olecranon bursa, since there's no special test or anything with that. So that completed my 2 evaluations for clinical for this semester. 2 ways that I can improve on my evaluation skills for my future evaluations for the next semester's clinicals is one, I had forgotten about the thumb varus valgus tests for the thumb and the hand special tests. So just since thumb and hand injuries aren't as common in athletics as I would think, just continuing to spend time each night reviewing the hand and thumb specifically, along with all the other pathologies that we have learned in the special tests and range of motion and manual muscle tests that we have learned in the past. So just continuing to spend extra time at night reviewing those, so I'll remember those and keep them in my head for future evaluations so I won't forget them, because they're a key point and aspect of diagnosing the different injuries. And a second way that I can improve my evaluations in the future is just every time that Jordan does one, just to continue to learn and observe the different ways that she does hers. So maybe I could use her skills and her evaluations in my future evaluations. So just learning at the different ways that she does hers to see if I can take anything that she's doing with her evaluation and use it in mine to help me with my full evaluations in the future as well. So just by continuing to study the hand and the thumb and